Close-Up is brought to you by the Kia Sorento R, redefining the power of Kia.
Ever been kept awake by horrendous snoring? If you have, there's a good chance your partner's got what's called sleep apnea. And that terrible, terrible snoring is one of the side effects, as is stopping breathing while you're asleep. And it gets worse. Sleep apnea could be linked to that absolute killer of diseases, heart disease. Here's Alexi O'Brien.
I did wake up quite a lot.
It's strangely compelling viewing. The sleeping, the snoring, and then this. The silence.
I was quite surprised how many times I supposedly stopped breathing in the night.
Imagine stopping breathing for up to 30 times an hour, for up to 30 seconds at a time, because of a condition called sleep apnea, when the muscles in the throat relax during sleep, preventing you from breathing.
It's caused by lots of different things. Most commonly it's caused by being overweight, carrying increased weight around the neck or around the abdomen. It tends to make the throat more collapsible and more likely for it to block when you're asleep.
That blocking also causes snoring, and Colin's always been a snorer.
It was amazingly awful. I think if we had a bigger house, I would have moved out into another room at night. I could still hear you snoring through the wall.
And think about sleeping next to someone who's both noisy and then completely still.
I used to wake up when he stopped breathing and then wait for him to start, and if it went on for too long I'd have to kind of elbow jolt him. So therefore I wasn't getting a good night's sleep either. And for the two of us, we were just tired the whole time, and it kind of takes the sparkle out of things.
Margaret used to say whenever I was talking, I yawned just about every second or third word.
Oh, they look like REM eye movements, don't they?
They do.
Colin's part of an international study trying to find out whether treating sleep apnea prevents heart disease. He's a perfect fit for the study because he's already had heart trouble.
Halfway into the hospital, apparently my heart stopped. They managed to get it going again, and in the emergency room, it stopped again.
We know that there is a higher rate of heart disease in patients who have untreated sleep apnea. Certainly hypertension, high blood pressure, heart attacks, stroke. What we don't know is whether if we treat the sleep apnea, those things will improve or become less frequent. And we assume that it will, because it makes sense to think that, but there's actually no evidence to prove otherwise.
Dr. Levat believes that evidence could have a huge impact on our health funding.
1 in 5 adult men have sleep apnea, and if you think that all those people may be at risk of cardiac disease and you can do something to prevent it, it's a huge opportunity to improve individual and population health. This is showing just a small segment of breathing during the patient's night's sleep. This is where their normal breathing pattern is, and these marked in red are periods where they've stopped breathing. The worst I've seen is 120 an hour, so that's stopping breathing twice a minute.
That sounds horrific.
It is. It's just mind-blowing when you can imagine if every time you stop breathing you wake up. So imagine being woken 500 times a night and imagine how you'll feel the next day, and that's how these people live.
Luckily the fix is simple. This contraption, known in sleep circles as the CPAP, for controlled positive airway pressure.
How does that feel?
There's a lot of pressure in your throat. You've got to keep your throat closed or else the air just comes straight out your mouth.
It prevents the throat from collapsing and blocking off, and it helps to return a normal breathing pattern during sleep. And that's now accepted as the kind of gold standard #1 treatment worldwide, and so that's why we're using it in this trial.
It's not very romantic though, is it?
No, it's not, and our younger patients take a bit of convincing to use a CPAP machine. But it stops people snoring, and there's often, you get wives back into the bedroom when their husbands get onto CPAP.
Colin's been sleeping with the CPAP for 18 months as part of the study. We asked him to spend a night without it to show us what it used to be like.
I woke up a lot more, like I've been holding my breath and having to breathe heavy to catch my breath again. Sort of like...
You'd forgotten what that was like?
I had, because I've had this on so long, I haven't actually had the apnea.
I firmly believe that it will actually prolong his life.